I've been working in patient engagement for several years now, but my experience in patient advocacy actually goes a long way back. I've lived with chronic illnesses since I was 3 years old. And from a young age, I was encouraged to get involved with nonprofits and to fundraise for a cure for my illness, which actually still doesn't exist. But I remember feeling like at that time, that model was very one sided. It was a one sided relationship, even back then. And there wasn't a lot of opportunity for me to become involved beyond fundraising, or actually to learn about the research that the fundraising was for. And so many years later, when I began my professional journey working in community organizing, I knew I wanted to find a way to incorporate patient advocacy and community organizing into my career. And I eventually ended up studying medical sociology and epistemology in graduate school. And I fell really in love with learning about the ways that lived knowledge, also known as experiential knowledge, is a crucial piece to science, a more accurate, holistic science, despite the fact that it's subjective in nature. How could I, as a qualitative researcher, study an illness that I have without some kind of bias? The reality is that we all come into research as research with our lived experiences and biases. And sometimes that actually means those biases give us certain insight that someone without those biases doesn't have. And so we have to rely on our scientific methods to ensure we produce objective science regardless of our biases. And we have to understand that those subjective lived experiences is knowledge that's imperative to the scientific process. So this particular conversation around science and lived knowledge is coined by epistemologists who study knowledge, and it has certainly influenced many folks working in the patient engagement space today. In the same coin, patient engagement is also influenced by community-based research, community-based participatory research that recognizes community members as essential stakeholders in decision making around research priorities and determining community needs. So, that being said, all of these things are influencing our current state of patient engagement methodology, but I want to make it really clear that the rising trend of patient engagement in clinical trials is a huge direct result of the disability rights ethos that says decisions about us should not be made without us, and also the legacy of patient and caregiver advocacy. And as you can see on this first column here, in successful patient engagement work, patients and caregivers are likewise considered essential stakeholders in the clinical trial development. It recognizes that patients and caregivers hold knowledge that can't merely be taught out of the textbook. It has to be learned by building relationships, gathering experience data, and systematically valuing the unique knowledge that we as patients and caregivers have about our own conditions. So as a patient myself who's been doing this in community organizing for a while, you can usually tell when organizations are doing this work in a way that actually reflects this deep paradigm and cultural shift that truly embeds patients as stakeholders in our processes. And what sets organizations apart, like I mentioned earlier, is when there's institutional and systemic support for patients in decision making and transform this very traditional way of seeing patients as having a passive role in clinical trials and research. And again, historically, research has had a very top-down structure where industry plays the sole role decision maker. And we need to rebalance that through our patient engagement work and create a more equitable research ecosystem that makes research accessible to patient communities and ensures that the industry includes patients and caregivers in spaces where decisions are made and rooms as patients we weren't previously invited, welcomed, represented, or paid equally as subject matter experts. And so one of the questions I really like to ask people when talking about patient centricity is if patients and caregivers were in the room with us, whether those of us that we're talking about is in operations or logistics or product or marketing, sales, etc., would they like what they hear? And are we using patient-centric, people-first language that's embedded with support and encouragement rather than shame and fear and compliance? And so really, it's our job as an industry to learn how to shift our language and listen to patients and caregivers as subject matter experts And if we don't, we aren't creating an environment that's conducive to successful patient engagement work. Patient centricity and engagement is really an ethos for all of us who work in this field, that we work for patients first, even if patient and caregivers aren't in the room to represent ourselves.